Hello and welcome. I'm so excited to be coming to you from the Riverview Emergency Department. It is brand spanking new. This place is so beautiful. I'm joined today by Paul. Thank you so much for being here, Paul. You are the Director of Emergency Services.
Yes, exactly.
So this is kind of like your baby.
Absolutely. It's been my baby for over a year and a half that I've been here, and I've been working at it very hard.
And it is about to debut. We are just kind of putting the finishing touches on it. So it is. What are some of the highlights here? You added twice the space, correct, as your old facility?
Yes, actually, we added a lot more than twice the space, but we did add a lot more rooms. So we're going from 12 rooms to 16 treatment rooms. And we have made this emergency room to flow very easily and with the patient in mind. And so it's a very patient-centered emergency department, so I'm very excited about that. When patients come now, they will be greeted immediately by an EMT, a professional, that will actually ask a few questions, put them into the computer, and get them straight back to a room. The triage assessment will no longer be done in a triage room, but rather done at the bedside with the physician and the nurse together. And then once the patient is settled and the treatment has started, then we can go ahead and register the patient and ask the insurance questions. So this is going to be a much quicker way to get them into the system and a much quicker way to get them through.
It is so wide back there, and the rooms that you have are so wide. You also have it set up that you can see all of your desks, or the middle area where the nurses are. You can see every room from the middle, correct?
Yes. It is based on a racetrack theme. In other words, in the middle of the racetrack is where all of our work areas are. So rather than working in rooms like we do now, we are working in a fishbowl, so to speak, and we can see out. All of the nurses and the providers can see all of the patient rooms at any time, and that's going to be so much safer and also much quicker delivery of care. We were thinking about getting everything as close to the patient as possible. In our trauma rooms, we have booms set up with our medical gases and all our electrical outlets so that we can actually put that right next to the patient, and they can get that care while we can walk freely around the entire bed and care for the patient's other needs, including imaging, lab, respiratory therapy, all of the different departments that come and help us with caring for the trauma patients. So we're very proud of that as well.
Awesome. Thank you so much for your hard work. It is beautiful. We're glad to be here. And if you have a chance, we know you don't want to be here, but if you have to be here, it's not a bad place to be. So thank you so much for your help, Paul.
Thank you.
All right, we're coming to you from exam room 8. This is beautiful. This is one of 16 new rooms. And as we've talked before, each room kind of has its own different thing. You have a trauma room. You have a room for mental health. This is just a regular exam room, but even in its own regard, it's pretty impressive, isn't it?
Yes, it is. So we did everything to make sure that we could not only keep the patient comfortable, but that we had access to all the state-of-art equipment that we need. So you can see that there's a computer at bedside, there is a procedure light, all the medical gases are along the wall, so we can treat that patient as effectively and efficiently as possible.
So even your most basic rooms are just like mind-blowing. I feel like it just really speaks to how wonderful this facility has been put together. Now, you were telling me that one of the things at the forefront of your brain this whole time was patient experience, and that you are delivering a service, but also you're delivering compassion and caring words and things like that, because anyone who's here is not here by choice for the most part. They are here because they're going through something tough.
That is so correct. When they come here, they're scared, they're vulnerable, and the first thing we need to do is let them know with confidence that we are going to treat them, and not only treat them safely and with quality, but with compassion, because healing is not just about treating them medically, it's about treating that fear.
Another thing that you guys did moving into this is you didn't just slap some ideas down on a piece of paper. You got focus groups involved in this, and you spoke to those people and said, you know, if you were recently just in an ER, what was missing from your experience? What could there have been less of? What could there have been more of? What was maybe something that attention to detail that wasn't there? So you really did your homework on this. Something I know you're really proud of is the CT scan area and the X-ray area, how that is all in-house and really close, and the ability to get from, an ambulance to that CT scan room like in a second, literally, not quite a second, but literally a minute. And I know you're really proud of that.
I am proud of that, and in fact, we're all proud of that. And I think that if people understood what you have to go through to be a stroke certified ready hospital, I mean, it is a huge process. And we did have somebody who was on our team that drove that process, and she did a great job. And we have seen such an improvement in our times. And now, as Paul had alluded to, we are third time running, have the shortest arrival to CT scan in the entire state. We expect that now that we're about 20 feet apart, we'll get it down under a minute.
All right, we just want to give you a visual of how close this CT scan room really is to where the ambulance comes in. So I'm standing here. Here are the double doors to where the ambulance would come in. There are 3 spaces for ambulances there. So this is a direct access to their garage. The ambulance comes in, and this already here is where the CT scan room is. So literally less than 30 feet, and you are in here getting this state-of-the-art service that you may need if you're a stroke victim or anything like that where you would need this life-saving CT scan. I mean, it is literally just feet away. It's incredible at how quick you can get these people the care they need.
Thank you so much. As I said, this has been a team effort. It's been a lot of people lifting to make this happen, and this is for our community. This is what our community deserves. They have supported Aspirus Riverview for over 100 years, and they deserve this kind of medical care close to home.
Be sure to come here, check out the Aspirus Riverview Emergency Department. It is beautiful. We hope you don't have to be here, but if you do have to be here, it's going to be a good experience. We can guarantee that.